Welcome to Jersey Matters. I'm Larry Menti. Across the country, opioid deaths are going down, but not in New Jersey. They're going up over 30%, the worst in the country. After all those efforts, why isn't it going down? But I should point out that there's one shining exception, maybe more than one, but especially Ocean County, that used to be the epicenter of the opioid crisis in New Jersey. Their numbers are going down, begging the question, what are they doing that the rest of the state's not doing? Here to talk about that is Prosecutor Joseph Coronato of Ocean County. By the way, it's tough to say congratulations because you still have deaths, but you have made inroads, and many other counties, most other counties have not. What are you doing that they're not doing?
Well, thank you, Larry. I guess when I became prosecutor back in 2013, we saw that our numbers were spiraling out of control, and we had to implement different procedures and different programs that I thought that was going to hopefully make a difference. And fortunately now we're starting to see the beginning of those programs taking effect. We were the first county to use Narcan back in 2014. And then in 2015 and 2016, we had the OR program. The OR program is when somebody is sprayed with Narcan or is administered Narcan, that they're presented to the emergency room, that a recovery coach then meets them at the emergency room and talks to that individual and hopefully convinces that individual to go into a detox facility and then go into treatment and then hopefully into a sober living.
Are they doing that in other counties?
The OR program started again in 2016, pretty much in Ocean County and then in Monmouth County, and it's now being spread across the state, and there's at least 10 other counties that have the OR program now.
Why wouldn't everybody be doing it if there's a success rate?
Well, again, there's funding, there's issues, you need recovery coaches, there's implementations, there's a nurse navigator. It's a little bit complex in the sense that when somebody's presented to the hospital, you have to have somebody who's going to be on call 24 hours a day, who's got to get there, it's got to be trained to be able to talk to that individual. And then the other thing is this: you need to have the beds available. You need to have the detox beds. You need to have the treatment beds.
I get it, but there's so. I mean, we're in the middle of a crisis. The rest of the country is going down. New Jersey's going up. There's lots of money. There's been federal money. There's now state money that was sent out. I know you only have to answer for your own county, but I don't get why everybody can't do it.
It is spreading, but then it became apparent to me is that, wait a minute, the only time that we're getting these people into treatment is when they're overdosing and at death's doorstep, which didn't seem to be fair. So we then turned to what we called the Blue Heart Project. That started on January 11th of 2017, and in 2 municipalities, 2 police departments, where you can walk into Brick and walk into Manchester, present yourself, no questions asked, and that they will get you, and that we will get you into treatment. When you go into the police station, whether you have any kind of money or not, we're going to get you clinically looked at. A clinician's going to do a clinical analysis of that individual, and then that person, if need be, is brought to a detox facility, and then that person is brought to into a treatment facility. When we first started in 2017, I never really thought that many people would be walking into a police station, but I was wrong. 373 people have walked into a police station in Ocean County. We now have spread it to 8 police departments in Ocean County. And as a result of 373 people walking into a police station in 2017 and 575 people being addressed in the OR program in the emergency room of hospitals in Ocean County, our death rate went down 25%.
Is anybody else doing this? Other counties doing this yet?
There is part of a Blue Heart program in Monmouth County. There's about 4 or 5 police departments, I believe, in Monmouth County that have it, and I do believe other counties. I know Burlington is about ready to launch. There is a similar program up in Bergen County.
That's 4.
All right. And they're now looking at it. Again, it's complex. It's not that easy to implement, but I think that they're taking a look how we do it, and now I think that other people will be copying our program and hopefully turning out throughout the
because the numbers show your success, and what you're talking about. We did a town hall on the opioid crisis, and we did here at Monmouth University, and the people that showed up, and we had a packed house, the people that showed up, the number one thing that they had a complaint about is that why does my son, why does my husband or wife, why does my loved one have to be a criminal to get help? Why do they have to be bad before we can do some good for them? And this program answers that exactly. You're saying you don't have to be, just come in and we'll get you help.
Yeah, and I think the thing that kind of shocked me a little bit, they're not presenting themselves to a hospital and asking for help. They're walking into a police station and asking for help. That means that they feel more comfortable going into a police station and knowing that we're going to address their problems than even some of the hospitals. So I was a little taken back by that. That's why the volume kind of shocked me a little bit. But the bottom line is we're expanding the program. In many instances, I use my forfeiture money. In many instances, we will, after they're clinically analyzed and we have a clinician who tells us what the issues are with that individual, it could be co-occurring, both substance abuse and also mental health. A lot of times we will transfer them, send them out of state. We'll fly them either to Florida, fly them to Texas, fly them to Minnesota. The bottom line is that, and most of these people, 95% of them to 98%, have no money whatsoever. But we're going to find a way with scholarships to either keep them in state or to get them out of state so we can help them based on their problem.
There's two fronts in fighting this epidemic. There's the treatment front, and that's what you've been dealing with. But there's also the law enforcement front and the prosecution front. You had the biggest bust recently when it comes to heroin in Ocean County. 28 arrests. It was Operation Heading Back.
Yes. Yes.
How did that come about, and congratulations on that?
Well, thank you. I think it's important to see that there's really three blocks. The first block is education and prevention, getting into the schools, trying to draw the line there. The second block is strong law enforcement, and the third block is breaking the cycle of addiction, partnering up with healthcare. The second block is what we were talking about now, which is our drug bust that we had. And we were able to track back where we could see that we found our local distributor that was working out of Ocean County, and we were able to track him into Monmouth County. Eventually went from Monmouth County up to Middlesex County, and then went from Middlesex County up to Essex County, Hudson County, and up in Passaic County. What I found, which I thought was, which I didn't really realize at first, is that once they were at the kilo level, which they were purchasing drugs at the kilo level, that they were true business people. And instead of just going to one dealer, they would have 5 or 6 dealers that they would deal with, so they would get the best price, the quantity they wanted, the quality they wanted, and when that dealer could produce it. So instead of ending up with just one drug dealer line running all the way up, I ended up with 5. And they would actually, you could see where they would go in different, so they would get the best price, and they would know that they could get this drug maybe on a Monday, and and then the guy said, well, I can only get it for you on Friday. So they would know about price and dealing, and it was a total drug network based on business. And it was interesting. Can
I stop you there for 1 second, because I do want you to continue on it, and I want to talk more about Operation Heading Back, but we have to take a commercial break. So would you stick around for one more segment?
Absolutely.
We'll talk about it then. We'll continue the conversation, especially the part about there was actually some drug factories, for lack of a better word, that were shut down, which I would imagine you'd say was the most important part of this bust. When we come back with Prosecutor Joseph Coronato of Ocean County, when Jersey Matters continues.